APGAR is a quick test performed on a baby at 1 and 5 minutes after birth. The 1-minute score determines how well the baby tolerated the birthing process. The 5-minute score tells the doctor how well the baby is doing outside the mother's womb. The test may rarely be done 10 minutes after birth.
Congrats on your new baby, Mom. I just have to take him over for a couple quick assessments. I'll bring him right back. He has a good cry, and he's not in any respiratory distress, so I'll give him a 2 for respiratory.
You're all right.
He has a good heart rate at 130, which is also a 2. His fingers and toes are a little blue, and his color is pink, so I'll give him a 1 for color.
Okay, Mommy, hang on.
And he has a good grimace and cries when we suction his nose, so that's also a 2. Alright, and he has a good muscle tone, so I'll give him a 2 for that. Alright, complete score is a 9, which means he tolerated the birth very well.
The healthcare provider will examine the baby's breathing effort, heart rate, muscle tone, reflexes, and skin color. Each category is scored with a 0, 1, or 2 depending on the observed condition. If the infant is not breathing, the respiratory score is 0. If the respirations are slow or irregular, the infant scores 1 for respiratory effort. If the infant cries well, the respiratory score is 2. Next is heart rate. Heart rate is evaluated by stethoscope. This is the most important assessment. If there is no heartbeat, the infant scores 0 for the heart rate. If the heart rate is less than 100 beats per minute, the infant scores 1 for heart rate. If heart rate is greater than 100 beats per minute, the infant scores 2 for heart rate. Muscle tone is next. If muscles are loose and floppy, the infant scores 0 for muscle tone. If there is some muscle tone, the infant scores 1. If there is active motion, the infant scores 2 for muscle tone. Next is reflexes. Grimace response or reflex irritability is a term describing response to stimulation such as a mild pinch. If there is no reaction, the infant scores 0 for reflex irritability. If there is grimacing, the infant scores 1 for reflex irritability, and if there is grimacing and a cough, sneeze, or vigorous cry, the infant scores 2 for reflex irritability. Skin color is lastly assessed. If the skin color is pale blue, the infant scores 0 for color. If the body is pink and the extremities are blue, the infant scores 1 for color. If the entire body is pink and the infant scores 2 for color.